Hello everyone, I'm Arti Bhalerao, the Chief Dietitian for Momstory. In today's section, let's discuss what to have in the diet if you have nausea or vomiting during the first trimester. In the early pregnancy, due to the changes into the hormones, especially the HCG and the estrogen, you may have some symptoms in the form of nausea or vomiting, which makes it unpleasant, also causes some amount of weight loss at times. Now, what are your key diet strategies to help you combat it? Certain dietary changes definitely help you to ease the symptoms. So, in these strategies, what do we do? In this, let's plan for small, frequent meals. Eating larger meals at one time is going to make you feel more nauseated. It is going to increase the acid production. So see to it that you are dividing your meals into small, frequent meals for better tolerance. Modify the diet to a little softer diet and a blander diet, which will mean to introduce foods which are simple and easy to digest. So with this, there is an introduction of something which is also rich in B6, especially your chickpeas, brown rice. These help you with better nutrients to ease the morning sickness or the feeling of nausea and vomiting. Avoid oily and greasy foods. These are going to trigger more of acid production. So see to it that diet definitely is comprised with healthy fats, but at the same time is not too oily or greasy. Plan for very good protein sources, including protein-based snacks are going to be helpful to combat nausea and vomiting. Certain examples to it would be introducing something like a roasted chana or makhanas into your diet, healthy nuts into your diet, some amount of eggs if you are an vegetarian, or some legumes which could be introduced as a healthy snacks are going to be making your symptoms better. Focus on including complex carbohydrates. So these are going to help you energize better. Oats, bananas, sweet potatoes, brown rice, whole grain cereals, millets are going to help you with the right energy sources to keep yourself energized and not fatigued. If you're fatigued more, you're going to be feeling more nauseated. Also focus that you are having enough amount of sleep. Are there any specific foods that are going to help you cope with it better? Yes. Introduce ginger into your diet. Ginger is going to be helping you with combating nausea symptoms. So ginger having in the form of ginger teas or boiling it with water and consuming it, or ginger based candies can be helpful. Second is going to be your lemons. Lemons are again very good. So introducing as a lime juice or sprinkling it over your food is going to be very, very important. Also mind the timing of fluids. Have it in small quantities, sip by sip. Having too much liquids while you are nauseated is going to worsen it up. So if you are nauseated, aim for dry kind of foods which is going to help you to cope up with it into a better manner. So what to avoid if you are having excess of nausea or vomiting during your first trimester? So you are going to avoid foods with a very strong odor or flavor. You are going to avoid excess of caffeine, avoid larger meals, and you are going to avoid oily, greasy foods. Keep the spices to a minimum. To know more, follow us at Momstory.